Where is interoperability making a difference in healthcare? That's a question I ask myself a lot. Well, let me tell you, I'm about to learn a little bit more about the value that interoperability is having in the revenue cycle process, something that we don't normally think about when we think about interoperability. Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. I'm Colin Hung, and joining me today on the program is Juli Forde, Director of Strategic Partnerships at ZOLL Data. Also, Erica Gregory, Senior Vice President at Netsmart. We're going to sit down and learn about the value that interoperability is having when it comes to patient experience and administrative workflow. Let's get to it. Juli, Erica, welcome to the program.
Thank you.
Wonderful.
It's really exciting to be here.
Yes, great to be here. Happy to see everybody.
It's great to see you both. Now, before we jump into the topic at hand, if maybe you could introduce yourself for our audience, that would be great. And Erica, we'll start with you.
Okay, wonderful. Well, hello, everyone. My name is Erica Gregory, and I am the Senior Vice President and General Manager for Revenue Cycle Management at Netsmart. We are a services and technology organization based out of Kansas City that covers the post-acute and behavioral health services market of healthcare.
Over to you, Juli.
Great. So Juli Forde, I am the Director of Strategic Partnerships for ZOLL Data Systems. And ZOLL Data is a division of the larger ZOLL Medical. And it's where we really house all of our innovation around the patient's experience, their financial experience, their interaction with their caregivers, and really harnessing all kinds of data to optimize that experience. And as you might imagine, that has a pretty large impact into the RCM space for healthcare.
Excellent. Well, thank you to both of you for being on the show today. We're really excited. And the topic at hand is interoperability, which I know for some of our audience are like, oh, interoperability, that word again. We've heard it all the time. But I want to dive into a very unique area of interoperability, and that is the parts that you play in, which is around interoperability in revenue cycle management. So can you explain to me what that looks like? Because when we hear interoperability, we normally think about electronic health records. I certainly don't think about revenue cycle management. So what does that look like?
Yeah, I'll start
Sure.
out if that's okay. But I love the topic. One, because you're absolutely right. Frequently, when we talk about interoperability, there's such a focus on just the technology of the care record or the EHR. And so it's a really interesting topic and one I find fascinating to talk about revenue cycle management as such a critical piece of interoperability. When you think about, core idea of no money, no mission, we've got to think about revenue cycle being really important for this. And when we look at roughly 60% of our claim comes out of our referral and admit and intake process, it's so important that that data flowing between multiple different areas of the organization, external to the organization, is absolutely accurate and is timely. So, when I think about the referral to admit process, I think if that's not streamlined and we don't have data integrity, we're never going to get to really good first pass pay rates. And we're going to forever spend all of this money in collecting on our claims.
And I think, Erica, you hit on some really important pieces of how does it impact the provider's overall financial health? But interoperability really centered around a focus around the patient. How do we make this whole experience easier for the patient and better for them clinically? And we focused on the EHR because of the clinical importance of that, and that made sense. But so much of the experience in healthcare today is a financial one. And the earlier I can engage and the more seamlessly I can engage, whether that's patient engagement tools alongside of patient financial data, and if there can be a free flow through interoperability of things like, what is this procedure? So that when I get that text on my phone, it notes it's about my mammography today, right? Because I might also be having a general checkup. And we juggle a lot of things as patients. And so I think there in RCM, as we've moved to front end interoperability, it really does improve the patient's overall experience, both clinically and financially.
Yeah, that's a great point. I think about too, just looking at the new CMS regulation, right, around interoperability and prior authorizations. All of us experiencing healthcare very personally, I can't think of anybody who hasn't had a frustrating situation with a prior authorization, right? And so, getting that referral eligibility prior authorization process streamlined, not only does it help the provider's financial standpoint, but it also removes some of that really frustrating piece for patients from engaging in care.
Both of your organizations have achieved some level of RCM interoperability. What are some of the benefits that your organizations have realized? And Julie, we'll start with you.
Sure. So at ZOLL, we work with partners. And so I have partners across the entire continuum of care. But I see things like real time interoperability of this data, reducing administrative burden by as much as 30%, improving patient collections by 50%, improving patient satisfaction across the board. And so when we really do bring this interoperability into ways that are meaningful for the patient and the provider, we get to that triple aim, right? Where we have clinical improvement, we have satisfaction improvement, and we have cost improvement. And all of those things are really at the heart of the drive for RCM interoperability.
Yeah, absolutely. I echo everything Julie said around that. And when we look at the soft pieces that drive to that triple aim, right? Enabling organizations to interact quickly with referrals. We're at a point right now where we have to be able to look at the best place to treat the patient, and whether that is inside of the four walls of the hospital or if that's in a home or community setting. And so that referral process has to be streamlined. And in order for that to be streamlined, we have to have the kind of real-time communication with eligibility, with coverage discovery, and with authorization. And I'm lucky enough to be one of Julie's partners, and also with the partnership that we both have with Inovalon, our interoperability helps us achieve that. We have a referral manager product that we can connect all of those data pieces together so that both provider and patient can find a home for where those services need to be delivered very quickly. And that's not always been the case in healthcare, and it creates that frustration and many times the inability to get care and have good access to care.
So Erica, let me ask, since you brought it up there, can you walk me through what a patient would experience and what a provider would experience when they've achieved that interoperability you just spoke about in terms of getting the prior auth and all of that other information, right? Like, so walk me through that. What does that look like?
Yeah, absolutely. Again, I think about it in looking at when a discharge to a different area of care needs to happen, right? Because I think that in the handoffs in healthcare is where we see breakdowns. And so I always see interoperability needing to address those handoffs. And so when I look at a referral process, whether it's to a long-term care, whether it's to home care, being able to find the right home for that care quickly many times means that we have to not only be able to transmit the care treatment plan needed, but be able to transmit, here is the eligibility that, or the coverage that this patient has, and here is what is required for that, so that the accepting organization has the ability to very quickly, through automation and a rule set, decide, can I accept this treatment? Can I accept this patient, and am I able to provide it for them?
And so without that interoperability, it sounds like, Erica, they wouldn't even know that process would take even longer. So that patient would be delayed, care would be delayed. And so having that all automated really streamlines that.
Right. Or possibly gets discharged to an organization that doesn't have the right assets to be able to provide the care. And so then you really create a situation where a patient is feeling like they're being bounced around, right?
For so long, the fiscal process was separated from the clinical process. And so I left my clinical encounter having no idea what I would owe, when a bill would come, who it would come from. And that led to incredible dissatisfaction with healthcare, right? The experience was wonderful until I went to my mailbox. Well, today, through interoperability, as I'm standing there at my visit or even before my visit, because of interoperability, my insurance has been verified. Maybe I gave incorrect information. That's been updated in real time. The correct coverage has been validated. The correct amount that I would be owed for a very specific procedure. So now, as a patient, I'm informed at the front end, and I can make decisions that work well for my family as well as meet the needs of my provider. And so that is a game changer. It's really moving the surprise of the sting of healthcare bills out of the process, because we can do things in real time now. And that really improves the patient satisfaction, but it also optimizes the provider's financial health as well.
So is that, I was just going to ask that, Julie. So it sounds like the improvement in patient satisfaction really is measurable when you have a fully interoperable revenue cycle process. For example, you just said less surprises,
Right.
less frustration with the whole
Right.
payment process.
Absolutely. And even just expediting of care, right? It's no longer the case that I need to spend 45 minutes at my visit taking care of paperwork, because
Right.
I've been engaged seamlessly through text or web portal. And all of that can be taken care of in the front end before I even arrive. And that's happening through interoperability. And it only happens through interoperability. And so it really allows us to do some really innovative things. For example, I can let you know in real time if you're eligible for a charitable program that we have at our practice. That's a wonderful experience. It also helps people afford care that they might otherwise not be able to afford. But we can only do that in real time when we're able to dive into these data sources, source them back in an intelligent way, and give the provider the information they need to align against their compliant practices. So
Absolutely.
it's really moving the needle in ways we haven't been able to before.
And I think about, just to add on to what Julie said, I couldn't agree more. If we really think too about situations where the patient is not the deciding party, right? So, for many of us, we have aging parents that we're trying to take care of. And so when you think about having to group all of those disparate data sources together and educate somebody who is taking care of a loved one, then it's really important that those data sources are intelligent and that the provider can explain those to somebody who may not be the covered party that's being taken care of.
Absolutely. Our core product of insurance discovery originated out of a pediatric ER in Cincinnati, Ohio. Because when you come to the ER, it's emergent. You may not have remembered to bring your insurance card. Grandma might have brought you, the nanny might have brought you. And after that patient left, the providers had no idea who to get in touch with, who was the guarantor, what was the patient contact information. And so we began this process of how could we solve things like this? And that was the first step, right? And now you're in a world where we've really been able to harness this data and yet do it in a secure and protective way, right? So all the regulations are important. All of the security certifications are important, but we're able to do that now, and it really makes a difference.
I understand that both of you, again, are partners with Inovalon, and one of the most effective ways to integrate, any product is through APIs. And so I was wondering if you could tell me a little bit about how that integration went and how you're leveraging those APIs, and whether or not it really did make a difference in terms of the ease of implementation or the ease of maintenance. Erica, maybe we'll start with you and then we'll go to Juli.
Absolutely. I mean, I think as we've been discussing, the importance of having that information timely and accurate and in a standardized fashion is critical for gaining interoperability and for helping provider organizations and patients alike. And so, for me, I see the APIs as the best way to achieve that, right? We can get real-time information in a standard format between partnering organizations. I serve a little over 2,900 clients that are on 19 different EHRs. And so being able to have a standardized file format that can interact with all of those different EHRs in a real-time fashion is huge, right? It helps me get consistency for those clients across whichever platform they're on. So we can help meet them where they're at, and they can still get to the amazing first pass pay rates that they're looking for.
Yeah.
Juli?
I think the APIs make things seamless. So for example, our API, it's really important to us that it's a single sign-on API, and there's just one. So you need to add another piece of our data. That's just an easy click of configuration. And it's easy to get set up and going. One of the most difficult things in interoperability is when you're working with a large health system, will hear, well, it's 18 months before I can even look at connecting you to anything, right? That's just a dead end. So for us, it was really important that our API was user-friendly, easy to set up. Ours comes up and running in less than a week of development work for our partners. And our API management tools along with that are really important. We're connected to to thousands of payers and in a number of partners and hundreds of data sources. And so to know to the millisecond where my latency is and who I need to get in touch with, it keeps everything flowing in real time. I really can deliver all of this information in 3 to 4 seconds. But I can only do that with that kind of analytics and streamlined functioning. And then I've got to have a wonderful partner on the other end of the line, right? Because it's one thing to identify that there's a latency issue. It's another thing for the other partner to go, I'm on it right now. And that's one of the things we love about partners like Inovalon, is there's a bi-directional relationship. We are committed to the same kind of patient experience. And we've got those tools to make it user-friendly for our end users, but also for both sides to be transparent and accountable, which those are really core pieces of interoperability, right? If it breaks, we're no longer interoperable, right? We're a headache. So you've got to protect against that.
Well, it sounds like the interoperability really allows both of you to deliver the kinds of end user experiences that you want. I mean, Juli, what you're describing is, you've taken on the burden and the work of integrating with all of those payers and all the other partners and bringing it together so that your clients only have to integrate with one set of APIs and not the 5,000 others, right?
Right.
And it sounds like from what you were saying, Erica, like those APIs really allow you to deliver that information in the right time in a very timely manner so that care isn't delayed for any of your end users. Did I sort of get that right?
Yeah, absolutely.
Yeah.
And because I get to partner with Inovalon and Juli, I get to take advantage of all of the work they've done of creating that connection.
Yeah. And we've always talked in IT about never be single threaded. That was a lot harder and a lot more costly before APIs, right? So we're multi-threaded, and APIs are a huge part of making that work, right? And so that's how you can really be reliable for your end users.
Let's get practical for a minute. We always like to try to get practical here on at Healthcare IT Today. What can a health IT company or a healthcare provider do to take a meaningful step towards revenue cycle interoperability? Juli, we'll start with you.
I think part of it is to open up beyond your misconceptions. One of the biggest obstacles that I hear is because we had a really difficult time with an integration years ago, we don't want to do it. Because we heard the article that Mass General over here had a security breach, boy, that's scary. And so really embracing the innovation and moving out into that innovation, because the gains are profound. And there's such downward pressure on healthcare in general, and particularly revenue cycle management, that really you've got to move into this space. You've got to optimize engaging with the patient early. You've got to ensure that your revenue is getting paid, and you need real-time tools to do that. Coverage discovery for when you didn't know what the patient's insurance is. Demographic enhancement and verification, where that's being fixed for you in real time instead of 3 phone calls. Prior authorization that can be down to 10 minutes instead of the average of 14 hours. But all of these things require that I get comfortable with interoperability and that I move forward. And that is new for a lot of RCM partners and providers. So I think part of it is just be willing to explore, be willing to see what's out there, be open to the conversation, and then pick the most meaningful piece of the puzzle and start there and see the gains you get and continue to add on. Because it's much more doable. It's not the 6-month headache integrations of the past. Things really have improved. I really would encourage folks to look at demographics. It is the easiest and simplest. People don't realize how wrong their demographics are for a variety of reasons. But what we know is that over 50% of denials originate in the front end. And once something goes into the denial bucket, even if it's an easy fix, like a birth date that's transposed, 25% of those never get paid. That's an enormous amount of revenue that is lost. And there are tools like demographic enhancement that in 3 seconds will take that information that the patient gave you, go out to all kinds of data sources and come back and say, here is the very best information on Juli Forde Smith. And boy, you had that date of birth transposed, or you didn't have a social, and here it is. And for example, at ZOLL Data Systems, on over 60% of the encounters we process, we enhance a core piece of demographic information that is necessary to get a clean claim out the door. That's just one small piece of interoperability that could reduce your denials by 50%. And of those, a 25% that you were just completely losing. So that's where I think you just pick one spot and dive in and see the difference it makes, and then go to your next place. And these don't have to be retooling your biggest process to see gain, right? And so that's my encouragement, is just find a spot that makes a big change without a lot of process change, and then you can begin to knock down the other things.
Yeah, I agree. We've seen incredible yield improvements across our clients. And because so many of our clients are providing community-based care, it's not a traditional intake process. And so having the ability to do MBI lookups for our Medicare patients, being able to do coverage discovery for looking for that supplemental or Part B coverage, it's incredibly important to make sure that it gets paid right the first time. And the yield improvement is significant. When we look at hospice and home care, having NOAs and NOEs on file timely is a real revenue impact. And so that yield increase from just having the data interoperable and timely is a big impact for our clients.
Yeah.
Juli, Erica, you guys have both shared so much great information. If people wanted to find out more, where can they go? Erica, where can they go to find more information about Netsmart?
So I would encourage them to go to ntst.com, where we have more information about the communities that we're serving and the solutions and technology that we offer.
And Juli, where can people go to find more about ZOLL?
Yeah, absolutely. So zolldata.com. So ZOLL with a Z, and we'd love to help.
Excellent. Well, again, both of you, thank you so much for your time and for all the knowledge you shared. It's been great having you on the program.
Absolutely. It was wonderful to see you all.
Great to be here, and I just appreciate the topic. Thanks so much.
Yeah, I want to thank Juli and Erica again for coming on the program and talking about the benefits of interoperability in the revenue cycle process. It is not a topic we talk a lot about, and it's certainly not the first thing that pops into mind when you think about interoperability. But I certainly appreciated some of the examples they gave of how much different or how much better they are making the patient experience and how much better they're making the administrative experience by reducing that friction when it comes to a lot of the revenue cycle processes with interoperability. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.